Well, continuing our new segment tonight, focused on your health. Dr. Trevor Arnason is Ottawa's Medical Officer of Health. He will join us every couple of weeks to talk about pressing health issues or dispel some myths and focus on the facts. Tonight, it's about vaccines and the time of year when many are at risk, of course, of respiratory illnesses. The clinic's offering flu, COVID-19, and RSV vaccines just underway now here as we're well into October. But we want to start with the news of the week, if we can, Dr. Arnason. And of course, new cases of measles here in Ottawa, 5 cases within one family. How concerned are you at Ottawa Public Health about the measles?
So we're actually not that concerned because we have very high levels of measles vaccination in the community, and we don't see spread within the community. So, when we see here 5 cases, that sounds like a lot, but measles is a very contagious disease, and it can spread very quickly within a household, and these were all related individuals. So really, we're not concerned about widespread transmission within the community.
All of that said, there is a vaccination for the measles, right, which kids should be getting on a regular basis.
100%. Yes, there's a 2-dose of measles-containing vaccines that children get, one at 12 months and then the other at 4 to 6 years old. And as I said, in Ottawa, we have very high levels of coverage.
Okay, that is good to know that we are getting those vaccines. All right, let's talk about respiratory illness season. We hear it every year. What does that actually mean?
Yeah, so respiratory illness season is the time of year when it gets a bit cold outside and we all start coming inside, and that increases the transmission of these viruses, which cause similar symptoms like cough, cold, runny nose, sneezing, and respiratory problems. And 2 of the really more serious ones are influenza and now COVID-19. Coming out of the pandemic, we're seeing increasing activity every fall season. And as well as RSV, a respiratory syncytial virus we talked about last week or 2 weeks ago. And those ones are all prevented through different vaccinations.
Okay, so let's talk about that. We want to get into the when and where, starting with when are the COVID-19, flu, and RSV vaccines all available?
So all of them are now available for certain groups. The focus with COVID-19 and flu is often individuals who are older adults. There are particular vaccines that they can get for flu and COVID-19 as well. We're really encouraging older adults and people with medical conditions, so respiratory conditions and other medical conditions, to get the vaccine. And it can be seen on our website, ottawapublichealth.ca/RespVirus, which talks about these different conditions that would put you at risk for these, and when you should get those vaccines. Everyone can get the vaccines, though, for COVID-19 and flu starting as of next week across Ontario.
Okay, now this feels like it should be a nice simple question to end off on. Where are the vaccines available? But there's a couple of categories here.
Yeah, so I would like to say that it was perfectly simple, but for COVID-19 and flu, we generally advise most people to go to a pharmacy. Pharmacists are able to give those vaccines. Some primary care providers like family doctors and nurse practitioners also provide COVID-19 or flu vaccines. But the RSV vaccine cannot be provided through the pharmacies. So those have to be RSV vaccines have to be through primary care providers like doctors or nurse practitioners.
So maybe a little bit tougher to get. Maybe they'll change the rules at some point. We'll hope.
Yes, I think they're working on that.
All right, Dr. Arnason from Ottawa Public Health, my thanks to you.